What if I told you one of the most controversial questions in health is about something most people never talk about? Yep, we're going there. Foreskin or no foreskin? It's the question that makes people squirm, but it's more important than you think. Here's the deal. Biology and culture both play a part, but neither side wins gold. We're here for facts, not medals. I'm your friendly neighborhood scientist, armed with a kettle, a sense of humor, and zero judgment. No genital Olympics, just curiosity and a cuppa. We'll bust myths, share a laugh or two, and I'll give you one practical tip you can actually use tonight. Quick gut check. Is this topic worth discussing? Comment yes or no right now, don't overthink it. And if you're sipping tea, you're in good company. Ready? Let's get awkward, in the best way possible. Open mind, open conversation, and maybe the odd dad joke. Let's dive in. Anatomy 101. The foreskin, medically called the prepuce, is a retractable sleeve of skin. It covers the glands when flaccid and can slide back during erection. A built-in turtleneck, if you like. 2 layers, outer skin and an inner mucosal lining that smells faintly of science and moisturizer. The inner lining contains specialized nerve endings and blood vessels, sensory and protective roles. Picture a shy snail, the glands, tucked away in its shell, the foreskin. If you prefer sunbathing snails, that's fine too. It's not a pointless flap. It's biological engineering, protection, moisture, sensation. Short recap, protective, sensory, and dynamic. Not decorative, functional. Next, why do so many people not have this piece of kit? Onwards to history. Circumcision is ancient. Think Egypt and rites far older than NHS appointment systems. Fast forward. Modern hospitals and public health campaigns shifted practice in some countries. Religion and culture, for example, Judaism and Islam, are major drivers. For many, it's a sacred sign. Medicine pitched circumcision in the 19th, 20th centuries as a cure-all. Many of those claims were debunked. Today, organizations like the AAP note some benefits but stop short of a universal mandate. NHS doesn't recommend routine circumcision. Often choices are intergenerational. Dads did it, so their sons got it. Traditions hold power. Question time. Do you think family traditions change health choices? Type 2 in the comments if you're with me. Next, we'll look at hard data and messy human experience. The debate continues. Scroll through any online forum, and you'll find a digital battlefield over circumcision and sensitivity. One side claims it's a devastating loss. The other insists it makes no difference. So what's the real story? The short answer is, it's complicated. The core argument against it focuses on the foreskin's inner lining. Proponents say this tissue is packed with specialized fine touch receptors. The argument is that removing the foreskin means losing this super-sensitive hardware, fundamentally altering sensation for the worse. But when scientists actually compare the two groups, the results are all over the map. While some lab tests show a slight difference in sensitivity to fine touch, many studies find no meaningful difference in what often matters most: overall sexual satisfaction, pleasure, or erectile function. After circumcision, the glans is permanently exposed, which can lead to keratinization. Think of a guitarist developing calluses. The surface may toughen slightly, becoming less reactive to incidental touch. But, and this is crucial, the nerves for deep pressure and orgasm are buried much deeper. They aren't going anywhere. Pleasure is a full orchestra experience. Time for a quick myth bust. Myth. Circumcision completely numbs the penis. Fact. This is a biological exaggeration. While the type of sensation might change for some, the penis remains a highly sensitive organ, packed with nerves, regardless of its foreskin status. Now let's step out of the lab because our brains are our most powerful sex organs. How we feel about our bodies is a huge part of the equation. Being the odd one out in a locker room can create real anxiety. In places like the US, it's the cultural default. In much of Europe, it's the opposite. Your perception, shaped by culture, is just as influential as anatomy. So why no definitive answer? Because studying this is an ethical minefield. You can't run a perfect trial where you flip a coin to decide for science. Researchers are left with observational studies, and pleasure itself is deeply subjective. It's like trying to scientifically prove which ice cream is best. So what's the bottom line? The evidence shows both groups are fully capable of having rich, satisfying sex lives. The body and mind adapt. It brings us back to our sunroof metaphor. One person loves the open-air freedom, another prefers the quiet, sealed roof. Neither is objectively better. Quick poll, type sunroof or hardtop in the comments. Which metaphor makes more sense to you? Ultimately, your opinion might be shaped more by geography than biology. But we've only talked sensation. There's another massive debate. Hygiene. Is one really cleaner, or is that a myth? Coming up next, we tackle the great cleanliness debate. All right, let's dive into the most common reason you'll hear for circumcision: hygiene. The argument is simple, almost intuitive. It's just cleaner, or the ever-eloquent less gunk. It sounds logical, right? No foreskin, no place for stuff to hide. But is the foreskin really a magnet for filth? Or is this one of the biggest myths in the entire debate? Let's bust this myth right now. That gunk has a name. Smegma, and calling it dirty is like calling earwax dirty. It's not grime, it's a completely natural, healthy bodily substance. It's a mix of shed skin cells and lubricating oils produced by glands to keep the glands moisturized and protected. Think of it as your body's own built-in moisturizer. So, pop quiz, is smegma a sign of disease? The answer is a huge flashing neon sign false. It's perfectly normal. Of course, just like any other part of your body, if you don't wash, it can accumulate and cause a smell or even irritation. But the solution isn't surgical removal. It's just simple, basic hygiene. So what's the secret, complicated, multi-step cleaning process? Here's your pro tip, and it's ridiculously simple. When you shower, just gently retract the foreskin as far as it comfortably goes. And I mean, no forcing. Then simply rinse the area with warm water. That's it. Notice what I didn't say? Soap. You actually want to avoid getting harsh soaps directly on the glands. That skin is delicate, and soap can strip away those natural protective oils, leading to dryness and irritation. After the rinse, gently pat the area dry with a towel before returning the foreskin to its natural position. The whole process takes, 10 seconds? It's literally less time than it takes to decide what to watch on TV. The idea that maintaining an intact penis is some major hygiene burden is, frankly, a complete myth. Now for the numbers game. Let's talk urinary tract infections, or UTIs. You'll often hear that circumcision prevents them, and technically there's a statistical link. In their first year of life, uncircumcised infant boys have about a 1% chance of getting a UTI. For circumcised boys, that drops to about 0.1%. It sounds like a big drop, but let's put it in perspective. To prevent just one UTI, you would need to circumcise about 100 baby boys. That means performing a surgical procedure on 99 boys for no UTI prevention benefit to them. For most pediatric associations, that math just doesn't add up. Okay, now the big one, HIV. This is where the conversation gets serious and, honestly, often misunderstood. Several large, important studies conducted in sub-Saharan Africa found that voluntary male circumcision could reduce a man's risk of acquiring HIV from a female partner by up to 60%. That's a huge deal, and it's why it's a key public health strategy in regions with high HIV prevalence. But, and this is a massive but, context is king. These trials were in places with very high rates of HIV and where access to other prevention methods can be limited. The same level of benefit has not been shown in other populations like men who have sex with men, or in countries like the US or in Europe where HIV prevalence is much lower. It is not a universal shield. So we have these small, context-dependent statistical benefits on one side of the scale. What's on the other? The procedure itself. Circumcision is surgery, and no surgery has a risk of 0. While serious complications are rare, they happen. We're talking bleeding, infection, and unsatisfactory cosmetic results. It's not a haircut. This is why most major medical organizations in North America and Europe take a neutral stance. They essentially say the health benefits aren't great enough to recommend it for every single baby boy. They leave the decision to parents to weigh the small potential benefits against the definite surgical risks, alongside their own cultural and personal beliefs. And let's be crystal clear on one final point about STIs. I'm going to say this slowly. It offers 0 protection against many common STIs like herpes, syphilis, or gonorrhea. Consistent and correct condom use is your real frontline defense. Wow, you're still here. We've gone deep. If you've made it this far, you're officially part of the inner circle. Drop a "still here" in the comments. I want to see who's sticking with me on this journey. Ultimately, if you have personal concerns or questions, maybe about a condition like phimosis, where the foreskin is too tight, don't ask Dr. Google. See a real urologist. They can talk you through all the options, including gentle stretching exercises and steroid creams, which often solve the issue without any surgery at all. And a crucial PSA for parents of intact boys: please never ever forcibly retract a baby's foreskin. It's naturally fused for the first few years of life and will separate on its own time. Just leave it be. Nature's got it handled. Now that we've covered the practical side, are you ready to dive into the most challenging part of this whole debate? The part that moves beyond medicine and into philosophy? We're about to tackle ethics, consent, and the fundamental right to bodily autonomy. You don't want to miss this. So, after all that, what's the final, definitive, end-of-the-line answer? Which one is better? The truth is, there isn't one. Asking which is better is like asking if curly hair is superior to straight hair, or if being a dog person is objectively better than being a cat person. They are simply different, not rungs on a ladder of superiority. One isn't an upgrade from the other. I know what some of you are thinking, but surely, Mira, one has a secret advantage. That's a common myth, often tied to outdated ideas about hygiene or health. But let's be clear, both are perfectly normal anatomical variations. Each comes with its own tiny set of pros and cons, most of which you'll never even notice in your daily life. Neither is a golden ticket to health, and neither is a guarantee of problems. True health comes from your habits, how you care for your body, not the specific blueprint it was built from. Okay, quick pause. If you've made it this far into a video about, well, you are officially one of my favorite people. Seriously, high five through the screen. It shows you're invested in your health and in breaking down taboos, which is incredibly cool. You get a gold star for the day. Now, for the single most important piece of advice in this entire video: get to know your own body. Think of it as your body's monthly check-in. Once a month, maybe in the shower while your conditioner is setting, just take a moment. First, look. Get familiar with your normal landscape. Then, feel. Using the pads of your fingers, gently check for any new or unusual lumps, bumps, sores, or changes that weren't there last month. The key is not to panic over every little thing. Our bodies are constantly changing. You're looking for changes that, for a few weeks, most are harmless. But early detection of anything serious is what truly matters. Now, for a little challenge, the real change happens when we take these conversations offline. I know it can feel awkward, like, hey bestie, pass the popcorn and let's discuss our respective turtlenecks. But you'd be amazed how many people have the same questions. So here's the mission. Drop a comment below. Not with personal details, but maybe share a myth you used to believe. Let's turn this comment section into the most supportive, well-informed health class the internet has ever seen. If you found this helpful, hitting that like button tells the algorithm gods to share this with more people who need it. And subscribing, that means you and I get to hang out again, which I'd really like, because next week we're tackling another big one you've been asking for. You won't want to miss it. But before you click away, let's end with this soft reflection. Your body is not a contest. It's not a trend. It is your home, the only one you'll ever truly have. So care for it, be curious about its quirks, and defend it from judgment, especially your own. Whether you're team turtleneck or team no turtleneck, you are whole and you are normal. Be kind to yourself. Thanks for being part of this conversation. I'm Mira. Remember, we care about you and your well-being. Stay curious, stay kind, and I'll see you in the next one. Cheerio!